Let us discuss today why kidneys get damaged in people having uncontrolled diabetes. Diabetes is a leading cause of kidney disease and sometimes referred to such kidneys as diabetic kidneys or diabetic nephropathy. It is estimated that 40% of people living with type 2 diabetes may develop kidney disease. Sri Lanka too is seeing an increase in the cases of diabetes, and the risk of getting kidney disease is extremely high, in addition to the risk through pollutants and herbicides used in rice cultivations. How does uncontrolled diabetes affect your kidneys? High blood sugar damages blood vessels in the body. That includes blood vessels in your kidneys. The sugar that is present in the blood vessels, being glucose, derived from the dietary carbs, is a culprit that causes the damage to the inner lining of your blood vessels. Normal fasting range of blood sugar varies from about 85 milligrams per deciliter, that is 5.6 millimoles per liter, to 100 milligrams per deciliter. A level from 100 milligrams deciliter to 125 milligrams deciliter, that is 5.6 to 6.9 millimoles per liter, is considered pre-diabetic. In uncontrolled diabetes, the sugar level can rise even more than 200 milligrams per deciliter. The blood vessels tend to thicken and plaques are formed, causing the blockage to the blood flow to the organs, including kidneys, extremities, and your brain. When the blood supply to the kidneys gets diminished due to arterial blockage, they cannot filter blood like they should, which results in waste products build up in your body. The kidneys make hormones and controls your blood pressure too. The damage to the kidneys is a slow process, and unless your doctor does some blood tests and urine analysis during the early stages, it will not be detected for a long time. Invariably, if you suffer from diabetes, you may be having high blood pressure, and that too will cause kidney damage. The earliest test that detects kidney failure is an increase of creatinine in your blood. It is a waste product of creatine, which is a chemical that the body uses to supply muscles with energy. Bodybuilders seem to take creatine powder as a supplement for the same purpose of building muscles. Breakdown of creatine in your muscles produces the waste product, creatinine, which is filtered through your kidneys into the urine. Elevated levels of creatinine level signifies impaired kidney function or kidney disease. Normal creatinine levels in your blood can vary depending on age, race, and body size. Normal range is for women 1.2 and 1.4 milligrams per deciliter for men. The greater figures may be an early sign that the kidneys are not working properly. If your blood creatinine is getting high, cut down on your protein intake in such as red meat, including dairy products. It is better to switch on to a more vegetable-based dishes. Another essential test done to find out kidney damage is Egfr, that is the estimated glomerular filtration rate test. This test is based on the amount of creatinine in your blood. A normal Egfr for adults is greater than 90 milliliters according to the National Kidney Foundation. This is the best test to measure your level of kidney function and determine your stage of kidney disease. Egfr seem to decrease progressively after the age of 40 years. For older people, it should read over 60 or higher. Below 60 may mean kidney disease. An Egfr of 15 or lower may mean kidney failure and needs dialysis. It is also observed that increased water intake can decrease Egfr. Among Sri Lankans having diabetes, in most cases, the Egfr starts decreasing and quick action needs to be taken to arrest the drop and improve kidney functions. This is something that most Sri Lankans are not aware of, and the doctors too do not stress the importance of improving your Egfr. Your diabetes needs to be tightly controlled by going on a low GI diet, controlling your weight, treating high blood pressure with medication, and walking over 10,000 steps daily. When your diabetes is under control, dropping of your Egfr seems to get arrested or improve. Most patients are ignorant of how to manage their diabetes control. Seeing your family doctor and adjusting your anti-diabetic management alone is insufficient. There are certain lifestyle changes that are required too. Most doctors in Sri Lanka do not have the time to explain proper overall management of diabetes.
Diabrisk Sri Lanka, a recent clinical study by the National Diabetes Association and King's College London, has found that 20% of Sri Lankans have abnormal blood sugar levels. Its main investigator says the population cannot afford to get ill as there's no cure.
The expense factor, the hospitalization factor, the amputations, the blindness, all that will just overtake us, and our people will not be able to cope.
I have observed in Sri Lanka my friends taking their Metformin with a drink of alcohol. If you tell them that alcohol and Metformin do not seem to agree, they will say, "We have been doing it for 10 years. We are okay." Metformin does not cause kidney damage. If your kidneys don't function well, metformin can build up in your system and cause a condition called lactic acidosis, a serious state you need to get admitted to the hospital. Metformin is a common first-line treatment for type 2 diabetes, can lower your risk of cardiovascular events like heart attacks. If your Egfr drops to 60, you should stop taking metformin. People with diabetes should get regular screening for kidney diseases. Tests include a urine test to detect protein in your urine. Filters in your kidney are called glomeruli. Due to damage to the blood capillaries and narrowing and clogging, there is leakage of protein from the blood into the urine. This is referred to as proteinuria. Under normal situation, kidneys do not excrete the precious proteins that are required to build the body. The protein that leaks is albumin. You can stop your protein leakage by increasing fresh vegetables and fiber intake. You should avoid foods that are high in potassium and magnesium if you have proteinuria. A diet rich in red peppers, cabbage, cauliflower, garlic, onions, apples, blueberries, raspberries, egg whites are recommended. You could always detect protein loss in your urine. If you see foamy, frothy, or bubbly looking urine when you use the toilet, that would be a sign you are losing albumin in your urine. Temporary rise in the levels of protein in urine could be due to dehydration and emotional stress too. The early stages of protein leakage from your kidneys is referred to as Microalbinouria. Persistent microalbinuria indicates a high probability of damage to the glomerular filtration capacity of the kidneys. Your doctor will start you on ACE inhibitor or ARB therapy if you have microalbuminuria. During this early stage, small amounts of albumin leaks into the urine. Early symptoms of diabetic kidneys appearing quite late with severe damage are severe swelling of the hands, feet and face, trouble sleeping or concentrating, poor appetite, nausea, weakness. Towards the end stage kidney disease, your skin becomes itchy and dry and you become drowsy. If you have diabetes, it is important to take steps to control with strict dietary and lifestyle changes as described. If neglected, you are bound to get complications and kidney damage is very common. Take all steps to tightly control your diabetes to avoid kidney disease. Hope this video talk was useful. Stay safe and goodbye for now.